Hello and welcome to the CPC Certification Review Training with Legacy. This training is designed to assist you in passing the CPC certification exam. This course is not designed for beginners. You should understand the coding process prior to taking this review. The CPC exam will have 6 questions testing knowledge of the 50,000 Series CPT pertaining to surgical procedures performed on the urinary system, surgical procedures performed on the male reproductive system, surgical procedures performed on the female reproductive systems, including maternity and delivery, and surgical procedures performed on the endocrine system. The urinary system consists of 2 kidneys, right and left, 2 ureters, right and left, bladder, and urethra. Kidneys are an important excretory organ. Kidneys eliminate urea, the chief end product of nitrogen metabolism formed by the liver. Besides excessive water, electrolytes, waste including toxins, and drugs are eliminated from the body via the urinary system. Kidneys serve a vital role in regulating the excretion of water and electrolytes, maintaining the normal volume and composition of body fluids. Kidneys also play a major role in regulation of acid-base balance, regulation of blood pressure, and regulation of red blood cell production. Blood enters the kidneys from the renal arteries through the renal pelvis area of the kidney, immediately breaking up into many small branches ending in capillaries. This functional unit of the kidney is the nephron, where materials are reabsorbed, urine is made, and channeled into the collecting tubules, emptying into the calyces, which then empty into the renal pelvis of the kidney. Ureters carry urine to be collected in the urinary bladder for temporary storage until it is eliminated through the urethra to the outside. Under normal condition, the bladder holds up to 500 cc's of urine. Under abnormal condition, much more than this. The testes are oval-shaped, about 2 inches in length and 1 inch in diameter. Testes produce and store sperm and are an endocrine gland secreting the male sex hormones into the bloodstream. Sperm are produced and mature in the seminiferous tubules and enter the epididymis. The epididymis is an elongated structure on the posterior surface of the testes. New sperm are transported to the epididymis and stored until mature. Seminal vesicles lie between the bladder and rectum. A thick fluid mixing with sperm is secreted. At the time of ejaculation, sperm enters the vas deferens. The vas deferens joins the duct of the seminal gland to form the ejaculatory duct. Male sterilization is a deferectomy, meaning part of the vas deferens is ligated or excised via an excision in the scrotum. This effectively prevents sperm from joining with other fluid. The scrotum is a sac containing the testes, epididymis, and vas deferens holding testicles outside of the body. Temperature cooler than the body is important in sperm production. When exposed to cold, the scrotum retracts or shrinks, pulling closer to the body. Warm temperatures result in the scrotum expanding away from the body to lose body heat. The prostate is a walnut-sized gland inferior to the neck of the bladder and surrounding the urethra. It is a combination of muscular and glandular tissue. An enlarged prostate can block or impede urine flow. Location of the prostate close to the rectum is important clinically. An enlarged prostate can be palpated by a finger placed in the rectum through the anal canal, called rectal exam. The penis carries urine through the urethra to the outside and is the male organ for intercourse, also known as copulation. The body, or shaft, contains 3 columns of erectile tissue. The tip of the gland's penis and is pierced by the urethra. The loose skin covering the penis forms a cuff around the glands called the foreskin or prepuce. Male circumcision is removal of all or part of the foreskin, exposing most or all of the glands. Diseases of the genitourinary system, Chapter 10, lists diagnosis codes in anatomical order as described in this presentation: kidney, ureters, bladder, and urethra. Diseases of male genitalia organs follows, also listed in anatomical order: prostate, testes, penis. Anomalies of the urinary tract are some of the most common congenital deficits, sometimes referred to as birth defects. Some of these conditions are asymptomatic. For example, a person can be born with only one kidney or extra ureters. Obstruction of flow by stones in any location, kidney, ureters, or bladder, produces severe pain. This pain has been described as being as intense as childbirth pain. It may be caused by a stone smaller than a pea. Hydronephrosis is dilation of the renal pelvis and calyces of one or both kidneys resulting from obstruction of flow of urine by a tumor or a stone. Polycystic kidneys contain multiple cysts of varying size diffusely throughout both kidneys, resulting in compression and destruction of the kidney perinechium, often causing hypertension and other problems. Inflammation of the kidneys is nephritis. A glomerulus is a network of capillaries in the nephron of the kidneys. Glomerulonephritis is inflammation and infection in glomeruli. It can be both acute and chronic. The progression of kidney failure can be gradual and is described using GFR. Generally, the worse the kidney disease, the lower the GFR. End-stage renal disease is the time that renal replacement therapies such as dialysis or transplantation are needed. The kidneys play a vital role in blood pressure regulation. Kidney disease can result in hypertension. ICD-10-CM hypertensive chronic kidney disease lists diagnoses related to hypertension related to kidney disease. The guidelines state whenever a patient has both chronic kidney disease and hypertension, you should report primary hypertension. If secondary hypertension is documented, it is listed. The guidelines define secondary hypertension as high blood pressure due to or with a variety of primary diseases, including renal disorder, CNS, endocrine, and vascular diseases. Diabetes doesn't always mean problems with blood sugar and insulin. Diabetes impetus is chronic excretion of very large amounts of pale urine of low specific gravity. The result is dehydration and extreme thirst, and results from inadequate hormone level of antidiuretic hormone made by the pituitary gland at the base of the brain. The word diabetes refers to diuresis or increased flow of urine. Pyelonephritis is infection of the kidney. A bacterial infection of the pelvis of the kidney often occurs when a bladder infection is not treated. The infection begins in the bladder and progresses upwards through the ureters to the kidneys. It is characterized by pain in the lower back, fever, chills, and often flu-like symptoms. Hydronephrosis is dilation of the pelvis and calyces of one or both kidneys, usually resulting from obstruction to the flow of urine. The kidney is often enlarged. A common result is infection and stone formation. Kidney stones are formed by salts, calcium, and sometimes cholesterol. Stones can be found at any point in the urinary system. Small stones may be passed without any need for intervention. There are multiple surgical services for removal of larger stones. VUR is backward flow of urine from the bladder into the ureter. This is a setup for an infection with stagnant and contaminated urine going the wrong way. Cystitis is a bladder infection. The reminder is again given to report the organism if known. Incontinence of urine is loss of control of urine. It is a common voiding disorder. Childbirth and aging are the primary causes. There are types of incontinence such as stress, urge, overflow, or a mix of these types. Urinary tract infection is a catch-all phrase used to describe various urogenital infections. It is often nonspecific and can be used to describe an infection anywhere in the urethra, bladder, ureter, or kidney. Most often what is meant is a bladder infection or cystitis, but it can mean any of the organs mentioned. The male genitalia system is primarily between codes N40 through N53 and are listed anatomically by prostate, testes, and penis. Each category contains a range of codes for specific conditions affecting the male genitalia system. The codes are further subdivided according to the specific condition or disorder. Please take a moment to review your book. Diseases of the male genital organs are listed anatomical and start with hyperplasia of the prostate. Hyperplasia is overgrowth of a tissue or organ due to an increase in the number of cells. It is not a tumor formation, but the size of the organ increases. BHP is caused by growth of the cells of the prostate gland. There is confusion regarding the terms hypertrophy and hyperplasia. They are often used interchangeably, but don't mean exactly the same thing. Hypertrophy is general increase in the bulk of an organ due to increase in size, but not in the number of individual tissue elements. Hyperplasia is an increase in the number of cells in a tissue or organ, whereby the bulk of the part or organ may be increased. In many instances, hyperplasia is more worrisome as a possible precursor to cancer. Prostate-specific antigen, or PSA, is commonly performed in older men. It is used as a screening test for prostatic cancer. An elevated level can be an indicator of prostate cancer. This area of medicine is controversial and not all agree on the management of an elevated PSA or even the management of a slow-growing prostatic cancer. Dysplasia of the prostate is more worrisome as a precursor to cancer. Dysplasia is less concerning than carcinoma in situ, a precursor to malignant disease. Hydrocele is a collection of serous fluid in a sac-like cavity, in this case, hydrocele of the testes. This is different compared to hematocele, which is a collection of blood in this area. Orchitis and epididymitis refer to inflammation of the testes and epididymis. These conditions result from trauma, infection, or metastatic processes. Circumcision is the most common minor surgical operation performed on male infants. It is the removal of foreskin of the male. For some, circumcision is part of a religious practice. Peyronie's disease occurs with plaques or strands of dense fibrous tissue surrounding the corpus cavernosum of the penis, resulting in penile bending and pain on erection. Please take a moment to review some of the other common male genital diagnoses. Congenital anomalies of the male genital organs include cryptorchinism, which is a failure of one or both testes to descend. Another common term is undescended testes. This condition is a problem due to body temperature and sperm. Neoplasm of the genital urinary system are listed in ICD-10-CM in the neoplasm chapter. Genitourinary tumors are most commonly occurring in the kidney, bladder, prostate, testes, and penis. The most common kidney cancer is renal cell carcinoma, occurring more often in men than women. Bladder cancer is also more common in men compared to women. Smoking is a risk factor. Prostate cancer is the second most common cause of cancer death in men and is usually slow growing. Testicular cancer occurs most often in young men. Treatment is often successful. Read the code descriptions in this section very carefully. Codes are specifically listed as unilateral or bilateral. In general, when using an operating microscope, it may be reported separately as long as it is not included in the code description. Finally, the same reminder regarding diagnostic and surgical endoscopies apply. A surgical endoscopy always includes a diagnostic endoscopy. Nephrotomy is incision into the kidney, which may be used to explore the kidney. Pileotomy is incision into the pelvis of the kidney. Nephrolithotomy is removal of a kidney stone. Remember, litho, calculus, and stone all describe the same thing. Percutaneous is from the outside, which means without an open incision. Excision codes report biopsy, nephrectomy, and removal of a cyst. The codes are listed by approach. percutaneous or open incision. Nephrectomy is removal of all or a portion of the kidney. This can be done either open or laparoscopically. Whenever you see radical used with a surgical procedure, think cancer. Radical surgery indicates that other tissues are removed. Ablation is removal of a body part or the destruction of its function via surgery or noxious substance. Related to kidney procedures, ablation of one or more renal masses is performed using cryosurgery. If ultrasound is used intraoperatively, it is included in the code. Ureteral repair codes are specific to the portion of the ureter being repaired. Coding concepts for renal abscess include type. Treatment for renal abscess or renal stone extraction may require a nephrostomy tube be placed. This is often performed under CT guidance, not only to place the tube, but also to perform the abscess drainage or stone removal. If this is the case, report radiological guidance in addition to the appropriate code for tube placement. Percutaneous removal of stones is coded by the size of the stone and usually will require fluoroscopic guidance and an existing nephrostomy tube or tract. In most cases, the nephrostomy tube has been placed during a previous surgical setting. If this is not the case, a nephrostomy tract must be created and reported. Lithotripsy is a non-invasive procedure for treating kidney stones using shock waves to break them up. They are then passed. Ablation of renal tumors is listed with radiofrequency and cryotherapy. Urodynamics pertain to the motion and flow of urine. Tests examine functional disorders of the lower urinary tract, bladder, and urethra. Urodynamic codes include supplies, instrument, and equipment necessary to conduct the tests. Some of these codes have both a technical and professional component to them. If the physician performs only the interpretation or the professional service, modifier 26 is used with the code. The penis section starts with the incision category where there are significant parenthetical instructions. Code 54015 is incision and drainage of penis, deep. Remember, there are also incision and drainage codes in the integumentary system. The destruction category is for the destruction of lesions of the penis. To select the appropriate code, you first select whether it is simple or extensive, then select the method of destruction. The excision category contains codes for biopsy, removal of foreign body, amputation, circumcision, etc. There are 4 amputation codes. The code selections based on whether amputation is partial, complete, or radical. Circumcision codes are selected based on the method and age of the patient. Make sure you pay attention to the parenthetical notes here. The introduction codes are used for various injection procedures and tests. The repair codes comprise the largest number of codes in the penis subheading and describe various repairs made to the penis. Penile prostheses codes describe insertion, removal, or repair of penile implants. Codes for penile implants are divided by the type of implant and the surgical intent: initial, repair, removal, or removal and replacement. Make note of the services done through infected tissue. Transurethral resection of the prostate is a type of prostate surgery done to relieve moderate to severe urinary symptoms caused by an enlarged prostate. Here's a tip. CPT code 52601 is used when this is the first time the patient has had TURP. Code 52630 is used when the patient has residual tissue or regrowth anytime after the original TURP. Orchiopexy is a surgical procedure used to treat undescended testicles, a condition where one or both testicles fail to descend from the abdomen into the scrotum during fetal development. Orchiopexy is typically performed on children between the ages of 6 to 18 months. If left untreated, undescended testicles can cause infertility, testicular cancer, and other complications later in life. By bringing the testicles into the scrotum, orchiopexy can help prevent those potential problems and improve the overall health and well-being of the patient. There are 3 approaches to this type of surgery. The female genitalia, or vulva, includes the mons pubis, labia, hymen, and Bartholin's glands, which is responsible for lubrication of the vulva. Also found in this area is the urethra. Some main functions of the urethra include passage of the urine from the bladder to the outside. Additionally, you will also find the clitoris, which is the principal female erogenous organ. Diagnosis codes are found throughout ICD-10-CM, with the majority coming from Chapter 14 and Chapter 15. Chapter 15 codes have sequencing priority over all other codes in ICD-10-CM. Codes from Chapter 15 are used to report any condition related to pregnancy, childbirth, and the postpartum period. There are a few codes that come from Chapter 21, which are also used, such as Z3A to report the weeks of gestation and Z34 to report supervision of normal pregnancy. If the pregnancy is incidental to the condition being treated, report Z33.1 as a secondary code. Documentation must be specific that the condition treated is not impacting the pregnancy. Chapter 15 codes belong to the mom only. These codes are never used to report conditions of the newborn. A distinction is often made between routine or normal pregnancy and high-risk pregnancy. About 10% of all pregnancies are considered high risk. When reporting routine, outpatient prenatal visits with no complication, category Z34 is used. The 4th character will identify if the pregnancy is the first or a subsequent pregnancy. The 5th character will identify the current trimester of the pregnancy. They are reported as the first listed diagnosis and should not be reported in conjunction with Chapter 15 codes. For patients who are considered high risk, use a diagnosis from category 009, which would be the first listed code. For both sets of codes, report Z3A for weeks of gestation as a secondary code. The female genitalia system is arranged by anatomy from outside to inside. Take a moment to review the terms on this page. The vulva is used to describe visible external female genitalia. The folds of the skin are called the labia major and labia minora and are part of the vulva. Removal of the vulva is a vulvectomy and can be partial, radical, or complete, and it is often done for cancer of these structures. The vulva is not considered a bilateral structure in CPT. This means a unilateral vulvectomy is a partial vulvectomy because the whole vulva has not been removed, just one side. Procedure codes related to the vagina are similar to codes for the vulva mentioned above. Code 57022, incision and drainage of vaginal hematoba, obstetrical postpartum, is the only CPT code related to obstetrical complication that is not found in the labor and delivery section. There are surprisingly large numbers of procedures that can be performed on the vagina. Under the repair section, procedures are listed to fix, repair, tighten, or support structures adjacent to the vagina, such as the bladder or rectum. Through childbirth and with aging, supporting tissues around the vagina lose strength and can require repair or support. This condition is similar to hernias in other parts of the body. Some of these repairs are open procedures and others involve endoscopy. The opening of the cervix is the os. The cervix allows menses out and sperm in. It then supports a growing pregnancy for 9 months as the baby, amniotic fluid, and placenta become heavier. It then stretches or dilates to 10 centimeters, allowing a baby to fit through and enter the birth canal or vagina. Disease conditions related to the cervix are manifested through bleeding, a discharge, or they may be silent. Precancerous and cancerous cells can exist on the cervix for years before any symptoms are present. Cultures, pap smears, colposcopies, and biopsies are all useful in diagnosing these problems. Because the location of the cervix is wedged between vital structures, the bladder and the rectum, a cancer of the cervix not detected before it spreads can have very serious consequences. Vaginectomy is a surgical procedure to remove all or part of the vagina. When coding for vagectomy, the key coding concept is complexity, such as partial, radical, or total. The coding concept for a DNC is the type for therapeutic or diagnostic included in the code descriptor. DNC is a surgical procedure in which the cervix is dilated and an instrument is used to scrape the uterine lining. Here's a tip. For postpartum hemorrhages, use code 59160. Hysterectomy can be performed via open, vaginal, or laparoscopic approaches. There is confusion about the term total hysterectomy. A total hysterectomy means removal of the whole uterus, the fundus, and the cervix. A subtotal, partial, or supracervical hysterectomy means removal of the fundus or top portion of the uterus only, leaving the cervix in place. Making things a little more confusing can be the abbreviations with letters used in medical charts and by medical personnel. A total abdominal hysterectomy, or TAH, and a total vaginal hysterectomy, TVH, are both abbreviations that specify the entire uterus removed and the route or approach for removal. Here is part of the key to all of this. We have been talking about the uterus only, no mention of the tubes or ovaries. Many are confused in thinking that a total hysterectomy means the uterus plus the tubes plus the ovaries are removed. This is wrong. The word total refers only to the uterus, not the tubes and the ovaries. Guidelines for maternity and delivery care are outlined in CPT. These codes are used for antepartum care, delivery, and postpartum care in uncomplicated pregnancies. Antepartum care is defined to include the initial visit with subsequent visits during pregnancy to include history, physical examinations, recording of weight, blood pressure, fetal heart tones, routine urinalysis, and uterine fundal measurement. The average number of visits during a normal pregnancy is 13, beginning monthly and then weekly in the last month. This is referred to as the global package or global OB package. Included in this global OB package is antenatal care, delivery of the baby and placenta, episiotomy and repair, and postpartum care. Postpartum care includes visits in the hospital and a 6-week checkup in the office. It also includes services related to cesarean delivery, such as a 2-week incision check. If there are other encounters due to complications or unrelated medical problems, they are reported separately. If a provider delivers a portion of the care, but not the entire package, there are codes to report this. This can occur in many situations, such as a patient moving or changing insurance coverage mid-pregnancy, a provider not on call or unavailable after providing antenatal care, or even a delivery on the way to the hospital. For example, Dr. A performs a vaginal delivery only, no antepartum or postpartum care, and can report the code for vaginal delivery only. Dr. A and the patient's primary OB, Dr. B, do not practice together. In this instance, Dr. B cannot report the global OB package. They can only use one of the antepartum care codes depending on the number of visits, and postpartum care only. Ultrasounds are not typically included in the OB global package. Depending on the payer, one ultrasound may be included, but any additional ultrasounds are not. These additional ultrasounds are separately billable. There are 4 different types of deliveries: vaginal, cesarean section, vaginal birth after cesarean section, and failed vaginal birth after cesarean section. After a patient has had a cesarean once, they can attempt to have a subsequent vaginal delivery. If they attempt labor with the intent of having a vaginal delivery and end up with a repeated C-section, this is known as a failed VBAC. The chart shows the 4 different types of deliveries and the different options for delivery reporting. A full package includes the full global service, 13 antepartum visits, delivery, and postpartum care. Coding twin pregnancy and delivery services can be challenging. Be aware, many payers will not provide additional reimbursement for twin deliveries. Many do not recognize twin deliveries as a complication of pregnancy. Additional documentation may be necessary. According to CPT Assistant by the AMA, if twins are delivered vaginally, code 59400 is reported with 59401 and a 51 modifier for the additional vaginal delivery only. The modifier 51 is necessary on the second code. Twins delivered by cesarean are reported with the regular cesarean code. If one baby is delivered vaginally and the other by cesarean, codes 59510 and 59409 with a 51 modifier are reported. Again, a modifier 51 is necessary on the second code. It may seem odd that this last scenario occurs. It actually does fairly often. In the case of twin deliveries, providers and delivery areas always must be ready to perform a cesarean. When the first twin delivers, several things can influence what happens with delivery of the second twin. For example, when the membranes rupture, the umbilical cord can come ahead of the baby. The cord can get tied in a knot. The cord can be around the baby's neck. It can present as a breech. The second twin can be larger than the first, and the list goes on. At this point, the second baby is monitored. If it is okay, a vaginal delivery may occur. If not, it may be necessary to perform a rapid or emergency cesarean. Terminology related to abortions can be confusing, but it is critical to understand, especially when interacting with patients regarding these matters. Types of abortion include spontaneous and induced. A spontaneous abortion usually is referred to as a miscarriage. Induced or therapeutic abortions refer to a medical termination of pregnancy. Spontaneous abortions are further described as complete, meaning everything has come out and no D&C or completion is required. This is reported using evaluation and management codes only. A missed abortion occurs when nothing has come out of the uterus. The pregnancy has failed, but no tissue has passed and there has been no bleeding. Tissue passed at the time of abortion is called products of conception. In the instance of an incomplete abortion, a D&C completion may be necessary, or code 59812. Inevitable abortion occurs with bleeding, cramping, and no tissue passed. This is very similar to a threatened abortion. Induced abortions are coded with range 59840 through 59857. A hysterectomy, or 59857, is similar to a cesarean. Usually this is performed in the case of a failed medical evacuation of the uterus or with a previous cesarean. Surgery is performed to remove the fetus similar to a cesarean delivery. Thank you for joining us for this review. If you would like more details about our intensive CPC training or any of our other training programs, please visit our website at medicalbilco.com.